Hi, everybody. This is another episode of MedTalk. I have with me Dr. René Cervantes, ophthalmologist with 20 years of experience that has its clinic in Tijuana. And we're talking about diabetic retinopathy, a very common situation that a lot of people with diabetes that are not treated can develop. Hi, doctor. How are you?
How are you? Good.
So I have a couple of questions that I think there might be of some interest for international patients. If I have my internal doctor all back home and I want to go with you to treat my eyes and do some procedures regarding this topic, can you and my doctor coordinate, or how does the process work?
Most of the time it will be advisable just to have a background situation of each and every one of the patient, because we need to know how was the control, the sugar levels basically. And also we need to know if the patient has allergies or use certain medications that may interact with our treatments. But most of the time, a brief summary of the control and the medication the patient use, it will be enough. I myself like to share what I see with my patients. So I always, in EMR, we always ask an email from the doctor who's treating the patient. So when we finish the consultation, the encounter, we send a full summary of what we found during that visit.
And if I want to get a treatment all the way in Tijuana and I want to drive there, how long do I have to stay there, or can I drive back home if you do that whole eye-opening thing or whatever the procedure is?
Well, the first visit is to assess the problem. It's always advised to have someone to drive, because we will have to dilate the pupil. So we do the fundus exam, and we do some tests like the fluorescein angiogram, which requires a dye injected into the bloodstream. Depending on the pigmentation of the eye, it can take up to 4 or 5 hours to come back to its normal status. So we strongly recommend to bring someone. Also, for the question, sometimes the patients are overwhelmed with their problems. They lack, basic questions. And sometimes people who accompany these patients, they have more openness to ask crucial questions. So a first visit, it can take like 3 hours at most.
I personally suggest that if you're going to the doctor for the first time and you're kind of nervous about it, in advance, write down all your questions and never be embarrassed. Ask the doctor any question you want. I think that's basic, so you can feel comfortable with the procedure and be well informed. And that will help, in most cases, calm your nerves a little bit. If I want to drive by myself there, can I go have the procedure with you and then stay there at a hotel one day and then on the next day drive back home? Is that convenient?
That depends. If we do like laser photocoagulation, if we do intraocular injection, there's no need for stay. You can go back home safely, obviously with someone who drives. But if we do a surgical procedure, like a vitrectomy, a cataract surgery, it's advisable to stay. You can stay in San Diego, because the drive from the border to here is like 3 minutes. So it's very, very, very close by. Or you can stay here in Mexico, and we have very good hotels less than a mile of range. So it's advisable, because we have to check the patient on the post-op, check how the pressure, and then prescribe the antibiotics, anti-inflammatory, other indications.
And in this type of treatment, can I start with you doing a virtual consultation and move on from there? Can that be a first step, or do I have to physically be there the first time?
It's much better to be here, because in ophthalmology, it's important to see the lesions, to make some tests that we cannot perform as of now here. We need to dilate the pupil. We need a special equipment. It's a microscope that magnifies, the inside of the eye. And sometimes we require the fluorescein angiogram, which also has the same sort of cameras and systems. So having a talk will only let me know that the patient is not seeing well, he had this treatment and this, but I won't be able to assess accurately a treatment.
If you're traveling for medical tourism and need accommodation, transportation, or a guided tour, visit the service section on our website, where you will find the best options we found for you. Follow the link on the description and start planning your medical trip today.
Okay, that makes sense. Thank you so much for listening. Thank you so much for your time, doctor.
Thank you.
Don't forget to see the whole full interview of advanced diabetic retinopathy. Well, I'm going to leave you the link to the full interview in Spanish. Until next time.